Hello, I'm reporting from Ganepão. I'm Professor Pierre Dechelotte from France, and I was happy this morning to participate in a specialized session on glutamine in clinical nutrition. The aim was to summarize the evidence from many positive studies and the debate that arose in the recent years because of some other studies. And we had first some reminder of the importance of glutamine, its biochemical roles, its importance in states of injury when the needs are increased and where glutamine becomes conditionally essential. And we know that glutamine has many important effects on immune function, on gut barrier function, the protection against oxidative stress, as well as also reduction of insulin resistance. Then we had a talk summarizing the evidence of positive studies that were performed over the last 20 years. We have studied in postoperative patients showing a reduction of infectious complications and length of stay. We have studies also in patients with acute pancreatitis needing TPN. And we had also a few studies with enteral nutrition showing that in burns and in trauma patients, enteral glutamine is warranted. Otherwise, if you keep on enteral nutrition for ICU patients, there is no evidence that we should use supplementary enteral glutamine. And the last study the last MetaPlus study also did not provide a rationale to include enteral glutamine in addition to enteral nutrition in a mixed population of ICU patients. Now, if we go back to the issue of ICU in patients needing parenteral nutrition, then we have quite a number of prospective randomized control studies that have been performed along the last 10 years, including our French multicenter trial, the Spanish multicenter trial, the Scandinavian multicenter trial, so quite a number of large studies. And all these studies altogether are summarized by the recent meta-analysis by Paul Wischmeyer, published last year. They show a significant benefit as far as infectious complications incidence is reduced, and also length of hospital stay is reduced, and there also a reduction of hospital mortality. The debate comes, of course, from the Redox study that was published 2 years ago, but we must consider that it is a very specific study with a very different design because it included very severe ICU patients with a high number of renal insufficiency, liver insufficiency, which are usually a contraindication to glutamine supply. And this study globally did not show any benefit. There was even some discussion about some post-hoc analysis suggesting might be an increased risk of mortality in patients who receive glutamine. But by no way this study really demonstrated toxic effects. The only thing we can see from this Redox study is that there was some randomization bias with more severe patients in the group receiving glutamine. There was also a very specific design why glutamine was given at a very high dose separately from nutritional support, and most of these patients were hardly fed. They received less than 50% of their needs over the time. So this is a very particular study, not supporting a new concept that would give very high glutamine separately from nutritional support in these ICU patients. So to summarize, we have collected all these informations about the last 20 years showing that parenteral nutrition supplemented with IV glutamine is beneficial in postoperative patients, in acute pancreatitis patients, also in mixed ICU populations, provided that we take the right dose, which is 0.3 gram per kilo per day of dipeptide in postoperative and pancreatitis patients, and 0.5 gram per kilo per day of dipeptide in the ICU patients. So the right dose, the right patients, and also the right way of giving it. We should not forget that glutamine is a part of an optimized nutritional support and should giving along with an appropriate nutrition, either enteral when it's sufficient, or at least when patients need parenteral nutrition, then glutamine should be added. And it's still the recommendation of the European Society to go further with this practice. So I hope this helped you to better understand that there are some specific studies showing different things from the global bulk of studies showing beneficial results with glutamine. Thank you.